Sudden dizziness can feel alarming, especially when it hits without warning. But in many everyday situations, the cause is simple, temporary, and not dangerous. One of the most common reasons is a brief disturbance in the inner ear, the system responsible for sensing balance and head movement. Inside the inner ear, tiny calcium crystals normally sit in a specific location, helping your body detect motion. When these crystals slip out of place, a condition called BPPV occurs. This makes you feel as if the room is spinning when you turn your head, lie down, or get out of bed. The spinning usually lasts seconds, but the episodes can repeat several times throughout the day. Dehydration is another frequent cause of sudden dizziness. When your body loses too much fluid, whether from sweating, skipping meals, not drinking enough water, or even mild illness, your blood pressure may drop. This can cause a wave of lightheadedness, especially when standing up quickly. Even slight dehydration can make the brain temporarily receive less blood flow, creating a faint or unsteady feeling. Low blood sugar is also a common culprit. If you haven't eaten for several hours or your blood sugar drops unexpectedly, the brain doesn't get the energy it needs. This leads to dizziness, shakiness, and weakness. People with diabetes may experience this more often, but anyone can feel dizzy when glucose levels fall too low. These causes, while uncomfortable, are usually harmless and improve once the underlying issue is addressed. Recognizing when dizziness is linked to hunger, dehydration, or head movements can help you understand what's happening inside your body and prevent unnecessary worry. Sudden dizziness can strike unexpectedly, leaving you feeling alarmed and disoriented. Often described as the sensation that the room is spinning, this feeling stems from various underlying issues that warrant exploration. A leading culprit resides in the inner ear, home to delicate fluid-filled canals and sensitive hair cells that assist in maintaining balance. When disturbed by infections, inflammation, or pressure changes, these structures send mixed signals to the brain, triggering the unsettling experience of vertigo. Among the common conditions, benign paroxysmal positional vertigo, BPPV, occurs when tiny crystals inside the ear dislodge. This can cause brief spinning sensations, particularly during head movements. Other ailments from the inner ear, such as Meniere's disease and ear infections, may also accompany dizziness with symptoms like nausea or tinnitus, which only amplify the distressing experience. In addition to inner ear disturbances, reduced blood flow to the brain often leads to sudden dizziness. This scenario frequently occurs when someone stands up too quickly, resulting in a brief drop in blood pressure, known as orthostatic hypotension. Dehydration, skipped meals, rigorous exercise, or certain medications can exacerbate this situation, leading to feelings of lightheadedness. More serious factors, such as cardiac issues like arrhythmias or an inefficient heartbeat, can prevent adequate oxygen from reaching the brain. This may lead to symptoms including blurred vision, confusion, and in extreme cases, fainting spells, leaving individuals vulnerable to falls and injuries. Neurological issues also present a significant risk for experiencing sudden dizziness. Strokes and transient ischemic attacks disrupt the brain's balance centers, often accompanied by warning signs such as slurred speech, numbness, or sudden confusion. Migraines might manifest as extended bouts of vertigo, sometimes without a headache. Moreover, infections targeting the nerves or brain, such as meningitis or vestibular neuritis, can provoke intensified dizziness and difficulty walking, sparking urgent concerns for affected individuals. Recognizing the source of dizziness is paramount. Everyday factors such as low blood sugar from meal skipping, anxiety attacks, inadequate sleep, and medication side effects can induce sensations of lightheadedness. Keeping hydrated, eating regularly, standing up gradually, and managing stress can mitigate many common triggers. Yet severe or persistent dizziness, especially coupled with symptoms like chest pain or vision changes, necessitates immediate medical evaluation. Sudden dizziness can sometimes point to neurological problems that need quick and careful evaluation. Serious conditions like a stroke or a transient ischemic attack, TIA, may affect the brain's balance centers, leading to abrupt vertigo along with red flag symptoms such as slurred speech, facial drooping, weakness on one side, blurred vision, or sudden confusion. These signs require immediate medical attention, as early treatment can prevent permanent damage. Migraines are another common neurological cause. Beyond severe headaches, migraines can trigger intense vertigo that lasts for hours or even days. This dizziness may be accompanied by nausea, vomiting, and sensitivity to light or sound. Some people experience vertigo as part of a vestibular migraine, even without a strong headache, which makes the condition harder to recognize. Infections involving the brain or nerves, such as vestibular neuritis, encephalitis, or meningitis, can also disrupt communication between the inner ear and the brain. This interruption can cause sudden, debilitating dizziness and balance problems, sometimes paired with fever, neck stiffness, or hearing changes. Less frequent but still important neurological causes include multiple sclerosis and early-stage brain tumors. These conditions may begin with subtle symptoms like recurring dizziness, coordination problems, or unusual eye movements. Because these signs can appear mild at first, they are often overlooked until they become more persistent. Given the potential seriousness of neurological dizziness, timely medical evaluation is crucial. Doctors may use imaging tests, neurological exams, and blood work to pinpoint the underlying cause. Recognizing these warning signs early helps ensure prompt treatment, reducing the risk of complications and improving long-term outcomes. Did you know sudden dizziness isn't always a serious medical condition? Many common, everyday factors can also lead to these disorienting sensations, including low blood sugar, heightened anxiety, and medication side effects. Skipping meals or having hypoglycemia can cause shakiness, sweating, and lightheadedness. Your body needs consistent fuel to maintain brain function and energy levels. Anxiety and panic attacks are common. They may produce spinning sensations, a rapid heartbeat, or shortness of breath, mimicking vertigo. This is your body's intense physiological stress response, which can be unsettling. Certain medications, especially those affecting blood pressure or fluid balance, can trigger dizziness. Always consult your doctor if new prescriptions cause issues. Prompt adjustments may be necessary for your well-being. Lifestyle factors such as chronic fatigue, excessive alcohol consumption, or prolonged standing may worsen symptoms, increasing susceptibility. Dehydration can also play a significant role. While these causes are generally less dangerous, repeated episodes should not be ignored. Persistent dizziness warrants attention. Knowing common triggers and warning signs helps you respond quickly, manage symptoms effectively, and seek urgent care when necessary to prioritize your health. To prevent dizziness from benign causes, maintain proper hydration, eat balanced meals, get adequate sleep, and manage stress. These habits can reduce your risk of unsettling sensations. Understanding when dizziness is part of a serious underlying problem versus a temporary issue truly empowers you. It helps you take appropriate action, protect your safety, reducing the risk of accidents or injuries caused by sudden loss of balance. Stay informed and safe, putting well-being first.